Many places in the world are seeing a surge in COVID-19. South Africa is experiencing a lull in infections. However, now it appears that there is something else that might be a cause of concern. Israel has identified a case of a person infected with both COVID-19 and influenza. This combination has now been dubbed flurona. Is this something we need to be worried about? Well, we're now speaking to Dr Hannah-Lisa Tetteh, medical doctor and Africa health expert. Dr. Tetteh, good to have you with us here on your data update. The two don't come from the same family, do they?
No, they don't.
Yeah, although they have similar symptoms in a sense with fever and the likes. How different are they? I mean, one is a viral infection.
So influenza is the flu, that's influenza. It's caused by the influenza viruses. And COVID-19, as you know, is caused by the coronaviruses. In terms of symptoms and signs, they are the same. They both affect the respiratory system, the respiratory tract. So you have similar symptoms like cough, a sore throat, and they affect the lungs as well. When COVID-19 started, it was easy to differentiate between COVID-19 and the flu. But as time went on with new variants, you realized that there were even people who were asymptomatic to COVID-19 symptoms. So they have no symptoms at all, even with COVID-19. So now it's become a bit more difficult to differentiate between the two in terms of symptoms. But then they are both caused by different viruses, and they both affect the lungs and the respiratory tract.
How are they detected? And if you've got both happening at the same time?
So it's possible for both to happen at the same time. And now it's even a bit more difficult, especially because they are caused by, they cause the same respiratory symptoms. But of course, if you're able to identify the different viruses that cause it, so if you isolate the influenza virus, then you know that it's of course the flu. And if you isolate the COVID-19 virus or the SARS-CoV-2, then you know that it's COVID-19. So we're able to identify them by the viruses that are isolated in our examination and in our investigation.
So, I mean, what we know now, or at least what you doctors are telling us, is that when you've got comorbidities, for example, your situation becomes quite severe when you contract the COVID-19 virus. What happens to a person who already has contracted the flu when they now contract the COVID-19 virus?
So because they both affect the same organ mostly, that's the lungs or your respiratory tract, then of course it's like you've been slapped by someone. Let me just make it simple. You've been slapped by someone. Of course the slap is painful, but now you've been slapped again by another person in the same spot. So then the effect is exaggerated because they are both affecting the same place. So then there's a risk of pneumonia, then fluid in your lungs, and then other respiratory failure. But then the other thing is that because it reduces oxygen supply to other parts of the body, other organs can also be affected, such as your heart. There could be inflammation of your heart, inflammation of your brain, and then of your muscles. So other organ systems may be affected as well as a result of this. So when you have these two, then of course the risk of complication is higher because these two are similarly affecting the same parts of your body and then would extend to other parts of your body. So with the two, the risk of complication is higher, and even worse if you have comorbidities, because these make it difficult for your immune system to fight infection. And then it's fighting one infection, and then it now has to fight two others. That's the COVID and then the flu. So that's what happens when you have both.
Now, if, of course, you are vaccinated, does the vaccine respond or react in any way to the influenza virus?
If you are vaccinated against the influenza, then of course it's protective. If you're vaccinated against COVID-19, then it's protective. What these do is that they reduce the risk of complication from these infections. So if you are probably going to be hospitalized for maybe, let's say, a month, now you probably not be hospitalized, or you'll be hospitalized for 7 days, something like that. So it reduces the risk of complication and then the risk of death. So that means that, of course, it's protecting other organ systems as well. So if it was going to affect your heart at maybe at a 90% damaging rate. Now it's reduced. So the vaccine, by all means, is very, very good, especially now that we have a co-infection of both COVID-19 and flu.
And in terms of treatment, then, how do you treat both at the same time?
So we give, because they're both respiratory infections, we give medications that are aimed at treating both, so are targeted at treating both. So we have medications that are given for COVID-19, and then mostly the influenza virus is self-limiting, but we give things to support it as well. So we are giving medications that are aimed at targeting both and then protecting your respiratory system, your lungs, your throat, and then your nose.
So what would be your advice then, I mean, particularly for those who possibly could be at risk of catching both? Is it again the same advice we've been getting, vaccinate against both?
Yes, vaccinate against both, but more importantly, even if you've been vaccinated, please continue to practice the safety precautions, especially wearing your mask, because we know that they are both transmitted through aerosols and then droplets. So please wear your mask. Continue to wear your mask to protect you against both. Also, contact. If somebody coughs on the surface and then the droplets are left on that surface and you go and touch it, you can get both flu and COVID-19. So sanitize your hands as much as possible. Wash your hands as often as you can and as well as you can. So we continue to advise people to still practice the safety precautions that we've told them about in both cases, and get vaccinated if the vaccines are available to you. Most of the time, we don't make ourselves available for vaccines, but we're advising people to get vaccinated. And as much as we don't have winter in most parts of Africa, we have very bad weather. We can have the Harmattan, we can have the rainy season, and during this season, that's when a lot of people get these respiratory tract infections. So people are coughing, people are sneezing, they have sore throats, and so that's when most of the time our immunity is tested, and it has to keep fighting against these things. And now in the season where we have COVID-19, you don't want to put unnecessary or undue pressure on your immune system. This is not now the time for you to test if your immunity is strong or not. No. So continue to do what you are doing. Eat right, stay hydrated, eat a lot of fruits and vegetables, and continue to maintain the safety precautions.
Now, there are, of course, Dr. Tetteh, those families who've got their historical or family remedies for flu, for example, that they've used for ages and that believe in using those remedies. Do these in any way interfere with the treatment of COVID-19 if they prefer to use those for the flu?
So if we are going to talk about the remedies, then we won't end this program today, because every family has something that they take. I mean, I even have my mother calling me sometimes to tell me, oh, my grandmother said I should take this, so she thinks I should take it as well. So in Africa, every family would offer some remedy. But we keep saying that we can't speak to every remedy that a family offers. We all say that just keep eating the fruits and vegetables. We all know fruits and vegetables are very good and they are protective. So just keep eating them as organic as they get. You're getting them directly from the farms. Please keep eating those ones. I can't speak to every one of them, because even when I speak to this and I say, okay, you can take this particular thing, now I'm going to go to the issue of dosage. So how many leaves of this can I take, or can I take a pint of this? So just remain hydrated. Eat your fruits and your vegetables, which are available to every one of us.
Dr. Hannah-Lisa Tetteh, medical doctor and Africa health expert. Appreciate your time and, of course, that intervention and that update. Flurona, there you are. Stay hydrated, eat your vegetables, and, of course, vaccinate. And they are treated, of course, the similar way as they are both attacking the respiratory system of your body.